Chronic inflammation, the unseen friction in your body. Inflammation is not the enemy. It's a repair signal. Acute inflammation, like the redness after a twisted ankle or the heat around a small cut, is protective. The problem is persistence. Chronic inflammation is like a low-grade fire smoldering in the background. It often shows up as morning stiffness, achy joints, bloating, or irritable digestion. Fatigue that sleep doesn't fix, brain fog, low mood, irritability, elevated CRP, ferritin, or triglycerides on labs. Over years, that slow burn can nudge biology toward metabolic syndrome, atherosclerosis, osteoarthritis, flares, and in some contexts, contribute to asthma symptom burden or gastrointestinal disorders. It also overlaps with mental health through neuroimmune signaling. The immune system speaks to the brain via cytokines that can influence mood and motivation. What drives it? Ultra-processed foods, excess sugar and refined seed oils, sleep debt and circadian disruption, chronic psychological stress, sedentary routines and poor cardiorespiratory fitness, environmental irritants, pollution, secondhand smoke, oral health problems and chronic infections. Central adiposity, visceral fat is metabolically active and pro-inflammatory. Why spices matter, small inputs, big signals. Botanical compounds can modulate inflammatory pathways, not as magic bullets, but as steady nudges that tilt biology toward resolution. Two spices consistently catch my clinical attention: ginger and clove. They're accessible, inexpensive, and, when used appropriately, well tolerated for most adults. Ginger. What I look for clinically. Key bioactive, gingerols and shogaols. These molecules can influence NF-κB signaling, eicosanoid synthesis, and oxidative stress. Practical effects I've seen. Support for symptom relief in osteoarthritis patients over 8-12 weeks when combined with movement therapy. Reduction in delayed onset muscle soreness in active individuals. Digestive comfort. Ginger may aid gastric emptying and reduce nausea. Modest support for glycemic control in some people when paired with diet improvements. Mechanistic note: gingerols can reduce the generation of pro-inflammatory prostaglandins and cytokines. Think of it as dampening the amplifier rather than cutting the wire. Clove. Small dose, strong profile, key, bioactive. Eugenol. Potent antioxidant with COX-2, modulating activity. This helps downshift pathways that generate pain and swelling signals. Practical effects I've seen. Oral health adjunct, clove-containing rinses or microdoses in blends, alongside brushing and flossing. Occasional relief of tension-related jaw discomfort when patients improve oral care plus use clove in culinary amounts. Digestive support when used in cooking with warming spices. Important. Clove is potent. Respect the dose. More is not better. Sublingual delivery, when and when not to use it under the tongue, is an area rich in capillaries. Some compounds can bypass first-pass metabolism and enter the bloodstream faster. Practical truth from clinic. Certain people report quicker perceived onset using finely ground spices sublingually, especially for oral throat discomfort or when they avoid GI irritation. It's not a universal solution. Sublingual absorption varies with the compound. Some constituents absorb well, others don't, and taste or mucosal sensitivity can limit adherence. If you try it, think microdosing. The goal is signaling, not saturation. My evidence-informed safety-first protocols. These are educational examples, not personal medical advice. Always consult your clinician if you have health conditions, are pregnant, or take medications, especially anticoagulants, antiplatelets, diabetes meds. Option A: Culinary-first daily anti-inflammatory pattern awning. Warm water with lemon and a thumb-sized slice of fresh ginger steeped 5 and 8 minutes. Sip slowly, midday or dinner. Add 1/4 teaspoon ground ginger to stir-fries, soups, or lentil dishes. Add a pinch, literally a pinch, of ground clove to stews or chai-style tea with cinnamon and cardamom. Weekly rhythm, 5-6 days per week for 8-12 weeks. Reassess joint stiffness, digestion, and energy. Option B, gentle sublingual microblend for those who tolerate it. Who might consider this? Adults without mucosal sensitivities, ulcers, or bleeding risk. Those who prefer not to ingest larger quantities. Blend. Mix equal pinches of ground ginger and ground clove in a small dish. Start tiny, roughly 1/16 teaspoon total. Place a small fraction under the tongue. Let it sit 30-60 seconds, then swallow. Start once daily for 3 days. If well tolerated, consider 1-2 times daily for a 2-3 week trial. Adjustments. If the sensation is too strong, halve the amount or switch to culinary use only. If any burning, mouth irritation, heartburn, or palpitations occur, stop and reassess. Option C, tea-first approach for sensitive stomachs. Ginger clove, tea. Simmer, 3-4 thin ginger slices plus 1 clove bud, or a tiny pinch ground clove, in 300-400 milliliters, water for 8-10 minutes. Strain. Optional. Add cinnamon stick. Sip after meals to support digestion and a calm abdominal feel. Frequency. 1-2 cups per day, most days of the week. Safety checkpoints I insist on with patients. Medications. Ginger and clove can modestly affect platelet function. If you're on anticoagulants, antiplatelets, warfarin, apixaban, clopidogrel, high-dose NSAIDs, or about to have surgery, speak with your clinician before starting. Conditions. Gallstones, active ulcers, GERD prone to spice triggers, pregnancy and breastfeeding, warrant individualized guidance. Dosing discipline. With clove especially, stay with culinary or microdoses. Essential oils are highly concentrated and not equivalent to kitchen spices. Allergies/sensitivities. Any oral itching, swelling, or rash. Discontinue and seek medical advice. Stories from the clinic. Maya, 52, desk-based project manager with knee osteoarthritis. Baseline morning stiffness. 7/10, afternoon energy crashes. CRP mildly elevated. Already on a Mediterranean diet but snacked on sweets mid-afternoon. Plan. 12-week protocol. Daily ginger clove tea after lunch. 1/4 TSP ginger in dinner. Pinch of clove in a Saturday stew. 30 minutes low-impact cardio 5 days/week. Sleep regularization. Dental checkup for bleeding gums. Outcome. By week 6, stiffness 4/10. By week 12, 2/3 with improved stare tolerance. CRP decreased. Afternoon cravings reduced. She never used sublingual. Culinary route sufficed. Luis, 38, amateur runner with recurrent DOMS and desk stress. Plan, post-run ginger tea, optional sublingual microdose on hard training days. Magnesium-rich foods, breathwork before bed. Outcome, less next-day soreness, better adherence to training. He found sublingual useful before long meetings for perceived calm and subtle throat comfort. Annika, 61, prediabetes, periodontal inflammation. Plan, dental hygiene upgrade, flossing, water flosser. Clove in chai twice weekly, ginger in soups, 20-minute walks after dinner. Outcome, gum bleeding improved. HbA1c nudged down, and she reported lighter mornings. The key driver here was a combined approach. Spices were supportive, not solo therapy. The bigger picture. Spices are helpers, not heroes. Ginger and clove can help recalibrate inflammatory tone, but they work best inside a system. Nutrition. Prioritize whole foods, colorful plants, omega-3 sources, and adequate protein. Reduce ultra-processed foods and excess sugar. Movement. 150-210 minutes/week of moderate activity, plus 2-3 strength sessions. Sleep. 7-9 hours. Consistent schedule. Morning light exposure. Stress. Brief daily practices, breathwork, prayer, journaling, can dial down inflammatory signaling. Oral health. Treat the mouth as part of your immune system. It is. Weight. Even a 5-7% reduction in body weight, if indicated, can meaningfully lower inflammatory markers. Science in plain English: inflammation involves pathways like NF-κB activation, COX-mediated prostaglandin production, and cytokines such as IL-6 and TNF-A. Gingerols, shogaols may decrease COX and LOX activity, modulate TRP channels related to pain perception, provide antioxidant support that protects cell membranes from oxidative stress. Eugenol from clove may modulate COX-2 pathways, act as a free radical scavenger, provide topical analgesic effects in oral tissues at low doses. Evidence is promising but heterogeneous. Benefits tend to be modest and cumulative, not instant miracles. Think weeks to months, not minutes to a cure. How to track your own response symptom. Scorecard. Rate morning stiffness, digestive comfort, and energy. 0-10 each day for 2 weeks baseline, then during your 8-12-week SPICE protocol. Simple labs to discuss with your clinician. HSCRP, fasting triglycerides, HbA1c if relevant guardrails. Change 1 or 2 variables at a time. If no benefit after 8-12 weeks, reassess approach. Consider other drivers like sleep apnea, autoimmune conditions, micronutrient gaps, or biomechanics. My personal take after decades in medicine. The smallest daily habits often yield the most reliable dividends. Ginger and clove are low-cost, low-barrier tools that can improve comfort and resilience when used thoughtfully. Sublingual microdosing can be tried, but culinary integration is the most sustainable and evidence-aligned starting point for most people. Sustainable anti-inflammatory living isn't a single hack. It's a rhythm you can enjoy, meals you look forward to, movement you can repeat, and rituals that regulate your nervous system. Practical 7-day starter plan day. 2. Add ginger tea after lunch, 10-minute walk after dinner. Day 3, 4. Add a pinch of clove to a stew or chai. Stretch hips, hamstrings 8 minutes. Day 5. Try 1/4 TSP, ground ginger in a stir-fry. Lights out 30 minutes earlier. Day 6. Optional sublingual microdose test. A tiny pinch blend under the tongue for 30-60 seconds. If any irritation, stop and revert to tea. Day 7. Review. How were your mornings, digestion, and mood? Keep what helped, drop what didn't. When to seek medical input. New or worsening pain, swelling, fevers, mouth or GI irritation from spices. You're on blood thinners, have bleeding risks, ulcers, gallstones, are pregnant, or have chronic conditions requiring coordinated care. Key takeaways: chronic inflammation is a systems problem, addressable with systems solutions. Ginger and clove can gently modulate inflammatory signaling. Culinary use is the backbone. Sublingual microdosing is optional and person-dependent. Safety and dosing matter. Start low, go slow, and personalize. Track your response. If it's not helping, pivot thoughtfully. The goal isn't to silence inflammation entirely. It's to restore a healthy, responsive balance. Closing your kitchen can be a clinic when guided by good science and common sense. If today sparked an "I can start this" feeling, begin with tea and one recipe. Share your results in the comments so others can learn from your experience. If you found this valuable, pass it along to someone dealing with stiffness, brain fog, or an inflamed mood. Here's to clear minds, calm joints, and resilient bodies. One small daily habit at a time.